everyone, and welcome to another insightful episode of MedSynapse podcast. Today, we are diving into a critical and often under-discussed topic, which is urinary incontinence in men and women. This condition affects millions of people worldwide, yet it remains a topic many are hesitant to talk about. To shed light on this important issue, we are thrilled to have with Dr. Juile Khadke, an esteemed physiotherapist specializing in community-based rehabilitation. Dr. Julie holds an impressive array of qualifications, experience, and varied certifications. Currently, she is an assistant professor at Turner College of Physiotherapy in Navi Mumbai. Dr. Julie, we are delighted to have you with us today. Welcome to our podcast.
Thank you. Thank you so much. That was very kind of you.
To start with, can you share your medical journey with us?
So, I am a physiotherapist by profession. I have done my master's in community medicine, and currently I am working as an assistant professor. Earlier, I was into clinicals for about 3 to 4 years, and now recently I have shifted to ACADS, that is as an assistant professor, and I've been working. I had worked in an hospital and also in an geriatric home-based rehabilitation center. So yeah, that was my journey till now. So there were hospitals of orthopedics, then general surgical and gynec hospitals that I have been attached, and the old age home, like I said. And right now, I am as a assistant professor working in a college.
Thank you for sharing that with us. Now, moving on to a discussion about urinary incontinence. Are there any emerging technologies or treatment modalities that show promise in addressing urinary incontinence, especially those methods that are less invasive?
Yeah, sure. So, firstly, I would like to say that treating incontinence is um, it's basically training your pelvic floor. So, because you train your pelvic floor and you train it in under the guidance of physical therapist, so it is less invasive. It is also first line and low risk treatment that you can say. So it also has many different techniques. There is manual manipulation that we can use. So like using a myofascial release, then adjusting the trigger points, like finding the trigger points and releasing it. Or else there are other techniques like using an electrical muscle stimulator, interferential therapy, or you can also say that you can use an ultrasound also. There are perineal ultrasound or ultrasound therapy that you can use, which are less invasive, but it is useful, and it is also preventive in further continuance of incontinence.
Yeah, I think that's rightly said. Now, can you elaborate on the relationship between urinary incontinence and other medical conditions such as diabetes, neurological disorders, or prostate issues?
For now, all we know is it happens only in pregnancy, it happens post pregnancy. Females only have incontinence, but that is not true. There are many other conditions that also cause incontinence. So that is diabetes, as you said. So, what exactly happens in diabetes is because it gives chronic diabetic patient, they have a neuropathy that develops and that causes damage to the nerve. As it causes damage to the nerve, that also loses its bladder control. So that is why there are chances of incontinence in diabetes. Secondly, is that because they have an incomplete voidance. So because of that incomplete voidance, and there is residual that is remaining in the bladder, so that causes infection, and that can also again lead to incontinence. So that is the relation that causes the diabetic patient also leading to incontinence. Secondly, moving to neurological conditions, again same, because there is loss of bladder control, and there are many neurological conditions, that causes incontinence, like spinal cord injury, even a patient who has birth defects, spinal cord birth defects, then Alzheimer's. Alzheimer's are the patients who has incontinence. Then there are patients who has paralysis. So we say there is a neurogenic bladder that we say. So paralytic patients or a stroke patients, when they have incontinence, that is one of the cause is the loss of bladder control. So that is how it is related. Then most importantly is we say that these are the conditions, but the other conditions that we usually see in males, the who has prostatomegaly, so that is enlargement of the prostate, or the patients who have undergone prostate surgeries, even they suffer from incontinence. So they usually have increased frequency, then urge incontinence, we can say. So these are the patients that we see that along with just pregnant female or menopausal women, we also see conditions like these that also cause incontinence. So it's just not males and females that has incontinence. It is males also, and there are other conditions also that affect and cause incontinence.
Yeah, that was quite insightful and also some new information that we gained today. Now, given the underestimation of female urinary incontinence, as you mentioned, what strategies do you employ to raise awareness and improve detection of urinary incontinence in female patients, especially those who may not readily disclose their symptoms?
So, like you said, it is the need of the hour. Like females, they never agree to it, and even if they do, and people who are about 65 and up, so what they think is incontinence is adjustable. It is just the aging cause, and it is just an aging factor. So they don't look into that matter at all. They think that it is to be avoidable. That is just we have to live with it, and so that is where the quality of life is very much affected. But in my masters, I had done a project on urinary incontinence, and I had taken a group of 25 to 55 years, which is the young adult and the adult phase. So we got to know that there were almost 40% of the females who had overactive bladder. There was almost 51 females who had stress incontinence, and there were almost 30 to 45% who had urge incontinence. So we know only that age that we know that causes incontinence. But when we got to know that this age group also has, so how we do is there are very certain questions that we ask which are very specific. And when you ask that specific questions, no, you know that they have this type of an incontinence. So firstly is we ask if they leak when they sneeze, cough, or laugh out loud. So if they say that there is, yes, this is positive in my symptoms, then we tell them we segregate them as stress incontinence. Sometimes if we say that we ask the patient if do you feel the urgency, like they are in a room watching television and all of a sudden they have an urge to, out of nowhere, they have an urge to urinate, and sometimes after 1 hour or so it's fine. But within the 45 hours, if they say that I have an urgency to urinate, and by the time they reach to the toilet, they cannot control and they leak. So that is the time when we say that it's an urge incontinence. And sometimes people show mixed incontinence, which is overlapping of stress and urge. So this is how we segregate the patients, and we know that they are suffering from incontinence. And first and foremost, that the awareness is very much necessary in females in today's world, because earlier what used to happen, in earlier 90s, 1900s centuries, so that time the life expectancy was very less. It was hardly 50 to 60 years. Now because the life expectancy has increased, so the conditions have also increased, and incontinence is one of them, which is mostly seen in the postmenopausal females. So awareness, holding camps, or whenever there is a female who is coming to a gynae or coming to a physical therapist, this should be one of the questions that is to be asked, so that you can not even solve their problems that they're coming for, the condition that they're coming for, but this is also one of them which can also improve their quality of life. And also, when females do come with low back pain, they come with painful sexual intercourse. So we neglect pelvic floor, but that is also one of the factor which can cause weak pelvic floors, and that can cause low backache and painful sexual intercourse. So we should look upon that.
Yes, sure, definitely. In your experience, what role does pelvic floor muscle training play in the management of urinary incontinence, and how effective is it to compare to other interventions?
So pelvic floor training, whenever you go to a physical therapist, first of all, it is a trained physical therapist should go for pelvic floor training. And secondly, Kegel exercises not which can be done at home. You need a proper guidance for that. Just looking at for some YouTube videos or Google videos won't help you. You need a physical therapist for that. And the role that pelvic floor plays is very important. It holds your bladder, it gives base to your core muscles. So that is very much important. So it is important in pre-op and post-op surgical cases also. It is useful for training the structures, the muscles which are affected. So it helps in the physiological and morphological changes also in the muscles. Secondly, it also helps in helping with pelvic floor dysfunctions. It helps in sexual dysfunctions. So pelvic floor training is that important. So as I said, it is less invasive, and it is also a first line treatment. It can play an important role in all these parts. So that is why the role of pelvic floor training is very important.
Yeah, thank you for sharing that. Now, finally, can you discuss the role of pelvic floor rehabilitation in the management of urinary incontinence, including the effectiveness of various techniques such as biofeedback, electrical stimulation, and pelvic floor exercises?
So, along with just exercises, there are many aids also that helps in pelvic floor training. Like you said, biofeedbacks, electrical muscle stimulation. There are others, like I said, ultrasound, IFTs, which help in pelvic floor training. So, what it does is there is a biofeedback which is less invasive, but there are um, the probes which comes in different sizes. So what we usually do is these sizes as suitable for the patient, we tell them, and we use the pressure sensation that gives the feedback. As it gives the visual feedback, the patients they know how to improve in their pelvic floor training. So that is one of the technique that we use. Secondly is there are perinometers which give audio and visual feedback. So that also helps for the patient in visual feedback, and they know how to improve or progress in their pelvic floor training. Secondly, like I said, there are new innovations also, interventions also. Like there is one of the 2020, there is a recent uh, product launch called as Elvis 20, which is pelvic and 20. So that is a perinometer which is of this shape. It's an egg shape kind of a thing, and that too comes in different sizes. And this is very digital. It has an app called an M app, and you can have that app in your mobile, and wherever you go, it's very handy. So if you need to train your pelvic floor, you can just put in and you can do your work, and the feedback also. The app shows the feedback, so it's like from bad to good. So you know that you're training your pelvic floor good. So that way. So this is how it is done. And along with that, now in pelvic floor, we say that only Kegel exercises, that you lie down and do Kegels, is the only thing that we do. But it's not that. There are many Kegel activities that you can do. You can do it in sitting, squatting, standing. So pelvic floor is a very fun exercise to do. Like nobody would even know that you're doing the exercises.
Yeah.
So if you're training your pelvic floor, get a physical therapist, get an idea what a pelvic floor treatment training is, get a proper idea of how to train it, because there are many videos on online that you can see doing Kegels, showing Kegel activities and everything. But knowing how to exactly do it is another part. So these are the techniques, and lastly are the vaginal cones. But vaginal cones are the cones that we usually don't use it in all the, in all communities. People, there's no possibility of using vaginal cones in all communities. So that is why a pelvic floor, and along with that, biofeedback and all. So we can train the pelvic floor with that. So these are some of the techniques that we do.
Thank you, Dr. Julie, for sharing your insights and expertise with us today. This has been an enlightening discussion, and we are keen on exploring different topics in future. And many thanks to our audience for joining with us today. And if you are a healthcare professional with questions or an interest in exploring more medical topics, remember to connect with us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until we meet again, stay well and stay healthy. See you.